Hi, it's Patrick Hutzel from Intensive Care at Home, where we provide tailor-made solutions for long-term ventilated adults and children with tracheostomy by improving their quality of life, and where we also provide tailor-made solutions to hospitals and intensive care units to save money and resources by providing quality care. In last week's blog, I answered another question from one of our readers, where our reader asked how to get evidence-based care and treatment at home for long-term ventilated patients with tracheostomy and other medically complex patients. You can check out last week's blog by clicking on the link below this video. In this week's blog, I want to answer another question we get quite frequently, and the question this week is, what is required for an intensive care unit at home? This is a very straightforward and great question we get quite frequently, and I want to answer it succinctly to keep it short and get to the point. Number one, a client and a family ready and willing to go home instead of unnecessarily spending many weeks, months, sometimes even years in ICU or pediatric ICU. Number two, a team of experienced ICU and pediatric ICU nurses with a minimum of 2 years ICU or pediatric ICU experience and a postgraduate qualification in critical care. Our average number of years of ICU or pediatric ICU experience is 8 to 10 years, and we employ hundreds of years ICU and pediatric ICU experience combined in our business. Number three, equipment that enables intensive care at home, such as ventilators, spare tracheostomies, ventilation circuits, suction machines, monitors, suction catheters, resuscitation bags, humidifier, nebulizing machine, cough assist machine, face masks, Guedel airways, nasopharyngeal airways, tracheostomy dressings, dilators, and the list goes on. In essence, all the equipment that is needed in ICU, just now it's being used at home. Number four, a third-party accredited intensive care at home nursing service. Providing an intensive care substitution service at home like we do is a task that can be achieved with the right support structure and with the right policies and procedures. Applying intensive care in a home care setting is only safe if it's provided by evidence-based and third-party accredited care, just like in a hospital. You wouldn't want the baggage handler flying an airplane instead of the pilot, or would you? It's the same with intensive care at home. If you don't have the quality systems that enable ICU and pediatric ICU nurses to do their job safely, it's like flying an airplane without a pilot. As of June 2020, Intensive Care at Home is the only nursing service in Australia that has built and developed a third-party accredited quality system for intensive care at home nursing services. Therefore, we have built substantial intellectual property that enables us to keep our clients safe, even though they need intensive care. Next, number five, you need a medical team overseeing the care of the client. Number six, you need a robust and positive mindset. A robust and positive mindset is necessary as many intensive care units still operate under the outdated paradigm that intensive care patients have two options, which is A, leave intensive care and go to a hospital ward, or B, they don't survive and die. The good news is that this paradigm and outdated thinking is obsolete, and with intensive care at home, a third proven and evidence-based pathway has been developed successfully, putting many families and clients in control of their own home instead of intensive care. And last but not least, number seven, you need 50% less money. Yes, this is true and a matter of fact. In order to provide intensive care at home and in order to improve our clients' quality of life, or in some instances quality of end of life, you need 50% less money compared to an intensive care or pediatric intensive care stay. Instead of a funding body paying $5,000 to $6,000 per bed day, intensive care at home costs approximately 50% less than an ICU bed. It's a true win-win situation for all stakeholders. Families and their loved ones want to be at home, hospitals want ICU beds, and healthcare funding agencies want to reduce cost. If you have a loved one in intensive care with long-term ventilation and tracheostomy needs or any other medical complexities, you should contact us on one of the numbers on the top of our website, or simply send me an email to patrick@intensivecareathome.com. That's Patrick, Patrik, @intensivecareathome.com. And if you are an intensive care nurse or a pediatric intensive care nurse and you're looking to get out of the craziness of an intensive care unit and work for us in a much nicer and much more holistic and client-centric family environment, you should contact us as well and should check out our career section on our website at intensivecareathome.com. We currently have vacancies for experienced ICU and pediatric ICU nurses in Melbourne, on the Mornington Peninsula, in the northern suburbs, in Melbourne and also in Sunbury. So really all across the Melbourne metropolitan area, including country Victoria, and you can escape the hustle and the bustle of intensive care and work in a much nicer and much more family-friendly and holistic environment. You can also have a look at our service section where we detail exactly how we deliver services, or tailor-made services, I should say, for our patients and their families, but also for hospitals and intensive care units. We have also been part of the Royal Melbourne Health Accelerator program in the past for innovative healthcare companies. Thank you so much for tuning into this week's blog, and I'll talk to you in a few days. This is Patrick Hutzel from Intensive Care at Home, and I'll talk to you in a few days.